If you worry because you're only pumping a few ounces of breast milk each session, or if you feel like your milk supply has been decreasing since giving birth, this video may help you turn things around. Let's go through some effective ways to increase milk supply that are commonly recommended by breastfeeding experts. First, breastfeed or pump 8 to 12 times per day, about every 2 to 3 hours. Breast milk production works on a supply and demand basis. The more milk that is removed from your breast, the stronger the signal your body receives to make more milk. On the other hand, going too long between feeds or pumping sessions can signal to your body that your baby no longer needs as much milk. But what if you've been pumping frequently and your milk supply still isn't increasing? The reason may lie in the next point. Make sure you are pumping correctly. Many mothers think that they have a low milk supply, when in reality, their pump isn't removing milk effectively. Check the following. Is your flag the correct size? Is the suction level appropriate? Is your breast pump function properly? A flag that is too large or too small can significantly reduce pumping efficiency. And here's a mistake that prevents many mothers from increasing their milk supply, even when they are pumping very diligently, is skipping nighttime pumping session. At night, prolactin, the hormone responsible for milk production, naturally reaches higher levels. If possible, try to maintain at least one breastfeeding or pumping session between 1 a.m. and 5 a.m. This time window is especially beneficial for building milk supply, but pumping alone isn't enough. There is another factor that affects your milk supply more than you might think. It's your emotional well-being. Stress doesn't make your milk disappear overnight. However, it can interfere with your letdown reflex, make it seem like you have very little milk or that your milk is taking a long time to flow. Try to rest whenever possible. Ask family members for help with baby care. Listen to relaxing music. Avoiding comparing your milk supply with other mothers. There is also a very simple tip that only takes a few minutes but can help you remove more milk during each pumping session. Massage your breast before and during pumping. Gentle breast massage can help stimulate letdown reflex. You can apply a warm compress before pumping. Gently massage your breast in circular motion. Use gentle breast compression while pumping. These techniques can help milk flow more easily and allow your breast to empty more effectively. Next is something very important that you should pay attention to every day of the week. Eat well and stay properly hydrated. A balanced diet helps support your body's ability to produce milk. You should eat a variety of nutritious foods. Eat enough protein, drink 2 to 3 liters of water per day according to your needs. And importantly, consider adding warm milk to your diet. Choose unsweetened cow milk or unsweetened plant-based milk wherever possible. It's best to avoid condensed milk, as it is typically very high in added sugar. And finally, here's a technique that may be unfamiliar to many others but can be very effective for increasing milk supply. It's power pumping. Power pumping is a method designed to mimic the cluster feeding behavior often seen during a baby growth spurt. A common power pumping schedule is pump for 20 minutes, rest for 10 minutes, pump for 10 minutes, rest for 10 minutes, pump for 10 minutes. The entire session takes about 1 hour. You can try this once a day for several consecutive days if you are looking to boost your milk supply. However, results may vary from person to person. There is one more important thing to remember. Not all cases of low milk supply are caused by something the mother is doing wrong. Nothing wrong. Medical conditions such as hormonal imbalances, thyroid disorder, significant blood loss after childbirth, or other health issues can also affect milk production. If you try multiple strategies and your milk supply still hasn't improved, consider seeking support from a lactation consultant or your healthcare provider. I hope you found this video helpful. If you did, please subscribe so we can meet again in the next video. Thanks for watching.